when it's not me. So that is why we've given you sheets of paper to write your questions. So feel free and then jot down any question at all. Very soon we'll go around to collect all of them and we'll do our best to answer as much as we can. We will also encourage our online audience, hello, to also get down their questions. For you, you can be posting it as and when the program is going on. So without wasting too much time, I would like to welcome our guest once again in the person of Dr. Baaba and Dr. Ayongo Annan. I thought we'll clap for that. Our online audience, I want to see you clap as well. Hallelujah. So, Doc, I don't know which of you will want to do this, Anna, but I would really appreciate if, before we talk about, so the topic of our talk show is the female reproductive health, our concern, our issues, and so many other things. I know it's an extensive topic which we cannot treat everything right here. But we know by the help of the Holy Spirit, we'll be able to deal with the issues that concerns us today, right here and now. So I want one of you to help to explain to us how the female reproductive system is like, just to set the tone for us before we begin the interaction.
Thank you very much, and God bless you for this opportunity to meet here today and talk about female reproductive health in the Virtuous Women's Conference. The images are on the TV. Yes, I think it's easier if I go there.
Yes, you can.
Okay. So when we say female reproductive system, it's basically what makes us different from the males, our male counterparts, something they don't have. God made us specially with these features. And as you can see on the screen, all these structures you see here are located in your pelvis. Now when we say pelvis, that's the bone that supports your abdomen, sort of. So that's what goes down. So everything here is there. And based on how God created, based on how your sex chromosomes come together to form a female, which is an XX, these structures will develop. So it looks like a funnel, okay? And what you have first, let's start from the top. This is what we call an ovary. Into wena ebe tunkosia. And I'll make us to be an a tunkosia. So, if I mix English and tree, it's fine.
Yes, please feel free.
So, only ebe tunkosia every month. Into a sankosia, and I say, if it meets a male sperm, it will form a baby. If it doesn't meet a male sperm, it joins the uterine lining, which is here, and then it comes down as menstruation every month. Every month in the normal female. And there are two of them. So it can be here this month, it can come here this month, any particular order. It can even be one side giving the egg all the time. So when the egg is laid, it goes through a tube, like a water hose, like a pipe. That tube, and that's what we call the fallopian tube. So the egg will travel down that tube and come and rest in your uterine cavity. So this whole funnel muscular thing is actually where the baby will develop and grow. And then when it's matured enough, you get into labor and deliver the baby through your vagina, which is here. So this gives you like a brief overview, okay? If there's no pregnancy, it joins the lining here and it shells down here as blood, okay? So basically, if you can just pick up your ovary, which is here, your tube, which is here, and then the uterus itself, that'll be fine. Especially when we come and we are talking about infertility, it will make so much meaning to you. Okay. So we can move to the next slide.
Please. So thank you very much, Dr. Baaba. So we wanted you to understand, we wanted you to understand what it takes to have all the features in our female reproductive system, so that when we are talking about the issues, we will understand it better. So we will zoom right on to the main topic of the day, which is the female reproductive health. Thank you very much once again, Doc. So we proceed to talk about, so if there's a problem in the female reproductive system, are there indicators? How do you know that as a woman you have, as you described the female reproductive system, this is how God created it. So as a woman, how would you know that there's a problem with your reproductive system? I don't know who wants to take the question. Okay.
So, like she has described what it looks like. So you can see that there's an exit. There's a vaginal area. There's a vaginal area. So most of the time with the female reproductive system, in fact, before I get to that place, when we talk about female reproductive health, we are talking about this system that Dr. Damoah described, functioning well and functioning in a healthy way. That is what we are talking about. Not just when there's a disease, but that it is function. Everything, the ovaries, the tubes, the cervix, everything is functioning the way it should. That is what we are. It's so that to enable you to get pregnant or be able to reproduce. In other words, that's what we are talking about. And some of the signs that you may see or symptoms may be, you may see a discharge.
Oh, feel free.
Okay. Yabana ke kwenu konjo oshishin. Alo la banya jo oshishin. Alo omishi ba wo he may see some pain. Alo bana ke kwe ujeme omishi gbe ewo no fi o. Ekwenu ko efun yemi. Alo ekwe boni o menses yale. Ebwe ba regular. Alo in between menses se la ko hun Baaba. Ona naka ni bi fe no anything ni ba naka area me ni o ba feel pe. Sano bomodeno na keshi e chotu ese ake no kunyano ne sano ya o chonye no ya hospital na kwa kemini yano.
Wow. So she was talking about those who don't understand Ghana, different situations that happen. For example, some people have menstrual disorders. Sometimes the menses doesn't come, or even when it comes, it doesn't come the way it's supposed to come, or it's coming with pain. And she was also talking about difficulty in getting pregnant and so many other issues that borders around the female reproductive health. So based on that, we want to just touch on a few. As I said from the start, the issues regarding the disorders of the female reproductive system are many. And unfortunately, there's not much time to go deep into all the areas. But as much as possible, we'll take them one by one. And as and when you want to ask questions, you can draw us to those particular areas. So we know about, for example, this term fibroid is a very common condition, and some people even attribute it to the fact that it's even more common among African women than the Caucasians and the Europeans. And please, what is it and why is that?
Okay, so uterine fibroids.
Yes,
I
please.
believe that's what you mean. It's, like you said, very common in the black race. The actual thing that causes it is not known, but there are so many factors that tend to provoke it to happen. One being the fact that you are a black woman. One being the fact that it's in your family. So if your mother or your grandmother or your auntie have it, you have a high chance that you also have it, okay? And recently we've realized that the incidence is going high, maybe because of some environmental or dietary factors that we can produce. But the good news is that uterine fibroid is not cancerous. That means it's not the kind of cancer that you see, or the growth or the tumor, the kind of tumor it is. It's not the one that can spread and cause so much problems. We call them benign, meaning that they are swellings that does not usually cause problems in most women. There are actually very few women that will have uterine fibroid that will give problems like infertility or menstrual disorder or that. So if you go and take a scan, you may be told you have a uterine fibroid, but the size is small, it's not giving you any problems. You don't really do anything about it. So as to what makes us get the uterine fibroids, the exact cause is unknown, but it's multifactorial, like I said. The fact that you are a black woman is part, your environment, the kind of dietary things you eat, all those things contribute to it. Yeah.
Wow. Doc, please, do you want to add anything to that? So, does it affect the ability of the woman to give birth? And as she explained, does it mean that almost every woman has an element of it? It's just that it's benign, like it hasn't yet advanced to a terrible stage or something?
No, not every woman has uterine fibroids.
Okay.
Not every woman. And some people have it, and it doesn't affect them in any way. Hello? Hello? Yeah. So not every woman has uterine fibroids. And some have it, but it doesn't affect them in any bad way. Like my sister mentioned, it's benign. Okay. It's not cancer. That is it. And for some people, it can affect getting pregnant. In a small number of people, it can. Some too can have it and still have children. So the important thing is, when moment it is diagnosed, and it's something that you are interested in having children or you want to have children, then you need to see your gynecologist so that you have a way around it. But some have had pregnancy with uterine fibroids and have children. The only time it becomes a problem is, for instance, when it also makes you bleed too much or it causes you pain when you're having your menses. Then sometimes they may want to take it out, or it's getting bigger and covering the whole womb and then preventing you from getting pregnant. Then would want to take it out. But other than that, it's not every woman who has it. The moment you have it, you have to go to the clinic so that we take you as an individual, because everybody is different.
Wow. So it's not in all cases that it needs to be taken out through surgery. And there are also concerns about the fact that those who have surgeries, they are advised to get pregnant as soon as possible. Is it true? And if it's true, why is that?
The idea is that, you see, the uterus was made, to conceive minor surgery. But once you touch the uterus, you have a chance of getting maybe what we call adhesions and other things that can, or sometimes, depending on where the uterus is, you may take a bit of, depending on where the fibroid was, you may take a bit of the uterus. So the earlier you get pregnant, hello. So the earlier if you want to get pregnant, you get it pregnant, it's better for you, because the uterus has been touched by an external. You've gone in, which is not usually the case. So most of the time, that is the reason why we say that.
Oh, okay. Doc, you want to add something?
Yes, and also uterine fibroid actually grows with increasing age. So with time, the fibroids that have been taken out can recur again. Then you would have come back to square one based on why you took the uterine fibroid out in the first place. So that as soon as you recover from surgery, you are advised, especially if it was costing you infertility, to get pregnant as soon as possible, so that even if the uterine fibroid should recur, it will not cause problems for you.
Oh, okay. I know that there's so much questions bordering around fibroid, and as we go along with the questions, they'll be coming. We want to move to this condition called endometriosis. I don't know what it's called in our normal everyday English, but then what is it? And I hear it's also a common problem among women in their childbearing age. What is it, and how does it happen?
Okay, so endometriosis, when we looked at the uterus, you see the lining within the uterus is called the endometrium. The lining, the inner lining of the uterus where the baby is called the endometrium. and it has some tissues there. So that tissue is meant for only that place. But sometimes in some people, based on, genetics and then hormones and other things in the body, that tissue appears in other places. So you can see from our, permit me to get there, and then from our image over here, that this endometrial tissue should actually be within this uterus. But you can see some is appearing around the body of the uterus. Some is appearing in the ovary. Some is appearing around the fallopian tubes. You can see them. So these are pockets of endometrial tissue. And this endometrium is what is shed. And then you have your menses. So what happens in pregnancy is that this endometrium is preparing. After ovulation, pregnancy will occur. It's preparing. No pregnancy comes. Okay, now I need to shed off. So that's what we shed off, and then we get our menses. So you can imagine that if this tissue is found in different places, the kind of complications that can occur. Some of them can be having bleeding in some of these places, and pain as well in these places.
Yes.
So this is basically what endometriosis is.
So, Doc, this leads us to the symptoms. So if someone has this condition, what are the symptoms the person may have that can help you determine, even without a scan, that it could be endometriosis?
Some of them may have, like we said, pain during their menses.
Okay.
Some of them may have bleeding. Sometimes, so they may have pain during their menses, bleeding. But you still have to investigate with an ultrasound scan to be able to find out whether this is, because these same symptoms can also be with uterine fibroid. So you still have to do a scan and investigate before you can find out whether this is endometriosis or not.
And please, are there risk factors? Could it be that, as you said, for fibroid, it's not by maybe you doing anything. It could be genetic. Is it same for endometriosis, or it's a lifestyle thing? What are the risks?
Okay, so some of the risks, it's usually, we don't really know what brings it on, but hormones, hormonal imbalance. You know, the woman has estrogen, progesterone, we have some hormones in our body. So for some people, there's an imbalance, and then this thing occurs.
Oh, okay. Doctor, you wanted to say something?
Yes, I wanted to add that with the endometriosis, apart from your endometrial lining going around your pelvic structure, sometimes they can even travel as far as your brain.
Wow.
So they can go anywhere. That's what endometriosis just means. You have that lining outside the uterine cavity. It can be anywhere. One of the classical signs you find is that you have pain at this ectopic. Ectopic is like the new place the lining has gone. You realize you have pain in this particular place for every time you are having your menses.
So it may not even be in your pelvis. It may be somewhere else.
So let's say your endometriosis tissue is on your intestine.
Oh, okay.
So you realize that every time of the month when you're having your menses, that's when you have this particular pain to here. Some people will say that when they're having their menses, they can see it in their palm.
Oh, okay.
For all you know, it was endometriosis tissue, so it's reddened. Then you see it there.
Wow.
So the symptoms come about when you have your menses, that time of the month. That's why you realize that you have this other pain. But sometimes diagnosis can be so difficult that it's when the surgeon opens up and now see all the different seeds of the endometrial tissue. That's when he can say that, oh, it's endometriosis you have. Because then when he opens up your abdomen, your pelvic, now he can see the tissues on your ovaries, maybe on top of your uterus, instead of being inside your uterus, or maybe attached to an intestine somewhere or peritoneum somewhere. Then he can say that you have the endometriosis. And usually people with endometriosis also have infertility. So they would have been coming to hospital and you are investigating the cause of the infertility. So based on the various scans that you do, hormonal assays, or even sometimes you have to open up, that's when you realize that the patient has endometriosis. Then you have to give treatment for it.
Is there treatment for that?
So treatment is usually surgical. So you want to remove the ectopic tissues as much as you can. But you should know that the endometrium grows with hormones. So there are some medications that can bring down those hormones so that your endometrium doesn't go at the ectopic site.
So
Wow.
that means it's safer when it's detected early before
Exactly.
it progresses to the other organs.
Exactly.
Because by then it would be a little bit too late to keep it under control.
Yes, and
Wow.
especially imagine if you have all these endometriosis in your pelvis. Every month it will bleed there, then it will heal, then it will form what we call adhesions. Like adhesions is how when you even get a wound on your skin, you bleed, a clot will form, then it forms a scar, sort of. So then it will form a scar, closed. Then another month it happens. Then so by the time you actually open up, the whole pelvis is frozen. Frozen means like a stiff, because there's a lot of scars and things there, and it really, really causes infertility in women.
Wow.
So it's very important to diagnose it early so that the complications will be
And
few.
please, with endometriosis and fibroid, are there any age ranges that are common in our society based on your experience attending to patients? Have you seen any age which is the risk, like the high risk ages?
With fibroids, it's with increasing age. So one has to grow to, I've seen people in their 20s with huge fibroids. But most of the cases is with increasing ages, so it will be like your 30s, 40s, and so on. Surprisingly, when we get to menopause, your fibroids rather shrink.
Wow.
That's because your hormones have calmed down,
yes.
because they all need the hormones to grow, so it will shrink. But endometriosis happens every time. Even from a teenager, it can happen. It doesn't really increase it with age. It happens, it can happen at any age.
Wow.
I don't know if Dr. Ayongo was.
Wow. This even brings us to I read about retrograde menstruation, when you, instead of the menstruation coming out, it's rather, please can you touch a bit on that as well? Is it related to endometriosis?
That one is talking about some of the theories.
Okay.
You know, they can't say that this is what causes it or this, but this is one of the theories that they think may be the cause, because every month you menstruate and then it pours back into the system, then endometrial tissue, because like I said, that is what is shed, and then you have your menstrual period.
Wow.
So it sort of circulates around the system. It's one of the theories.
Oh, okay.
Yes.
So it's not really because of endometriosis?
No.
So can menopause also be a risk in like having retrograde menstruation?
Now you see, with menopause, like Dr. Damoah mentioned, your hormones are all
gone.
coming down. Everything is sort of winding down to a shutdown. So all those things that grow with the hormones all begin to shrink or begin to disappear.
Okay.
Yeah.
And there's also this growing problem of, people know it as PCOS, Polycystic Ovarian Cyst Syndrome. Please, what is it, and how does it also happen in a female?
Okay, so if you remember the first video I showed you the ovary. They may see a tunkosia every month. I said tunkosia around. So with people with polycystic ovarian syndrome, what happens is that the hormone that makes the egg generates the oocytes. Oocytes is the nkosiana ebeto every month. No? That hormone tends to be a lot. So instead of, let's say, the ovaries will start with, let's say, 15 oocytes. As the days go, some of them will die. 15, maybe about 10, maybe about 8, now about 5, now about 3. Then one pair never matured. Then that one will now be released into the fallopian tube. Occasionally you have 2 released, and that will lead to twins and things like that. But in the normal circumstances, just 1. So with people with polycystic ovarian syndrome, what happens is that instead of, let's say, 15, some of them die, they have enough hormones that now all the 15 are growing. So their ovaries, their tunkosiano, becomes extremely big. It becomes painful for them. And because of that, the kind of oocytes that's also released at the end of the month, now it will go through the fallopian tube. It's not a quality egg. So they also have problems with infertility as well. So it's like they're having too much of something that's supposed to be good. That's the problem they have. But aside that, you realize that they will have androgens. That's things that are more common in men.
Men, yeah.
So you see such people having obesity or growing hair where they should not grow those hairs, like on their tummy.
So you see a woman who has beard.
Yes, you have beard. So most likely, so when you see those things, then you can investigate. But usually when they do the pelvic ultrasound, they will see your ovaries, which is the tunkosiana. After they also see the plenty oocytes there, and it will point in that direction for you.
Please, do you have anything else to add?
Just to add to that. And then when they, like after the scan, they do a test on you and they see that your male hormone in you also have high levels.
So you can do a hormonal test as well.
You can do a hormonal test as well. So they diagnose it by that. The hormonal test, first of all, the examination, seeing all the hair, you call it hirsutism, where male should have it, women have it. And then the ultrasound will pick up the polycystic ovaries, and then the hormone assay to show that they have a disparity between two of the female hormones. The percentage there is not correct, and then also the testosterone, which belongs to men, is high.
It's high.
Yeah.
Wow. So does it mean it also affects their menstrual cycle?
Yes. Some of them may have irregular menstrual cycles.
Oh, okay.
Yes.
So then that means when you have irregular menstrual cycle, it could be so many factors.
Yes.
Apart from what we've mentioned, are there other conditions that lead to irregular menstrual cycle in women? Apart from endometriosis, fibroid, polycystic ovarian cyst.
Even stress can also cause irregular menstrual cycles.
Stress.
Yes.
Wow.
And then perimenopause, around your menopause. Also, you can also have irregular menstrual cycles. So once you notice that it's not like a straitjacket one thing, get to the clinic and then get investigated. First of all, history, examination, and investigation, and then we'll get to the bottom of it.
So does it mean if you don't have your menses, if you know you have your menses every month, and then maybe it doesn't come for 2 months or 3 months, it's not pregnancy because you've done a pregnancy test, you should go see a doctor because it's not normal?
Yes. Exactly. Okay. Exactly. If you know you're normal, and like I always say, you're normal for every cycle, 28 days, plus or minus 7 days. So you're looking at something like 21 to 35 days. But you know yourself, and you know that every 28 days I get it. Every 31 days I get it. Every 24 days I get it. So that if that change, it should be of concern now, so that you come to the hospital so we can investigate and see. If you come and investigate and we say, oh, it's normal, this might have precipitated your irregular menses. At least you have your peace of mind to go back and relax.
So it's even a wake-up call that when any abnormal thing is happening, we shouldn't stay at home. We should at least report to the hospital. We shouldn't take herbal medicine. What of herbal medicine? That one I know is quite, because our mothers will tell you, oh, no, draw way, no ma, ebema menses na ba. What is your take on that?
Our training doesn't.
That's beyond our training.
Herbal medicine package. So we would say that see your doctor, and then let them investigate you thoroughly to avoid any kind of complications later on in your life. Yeah.
And even sometimes we end up going to pharmacies because we know that the pharmaceutical shops have good pharmacists who can sell menses in bar, would you advise that one too?
No, and not at all.
Yes. You are going to a pharmacy with a prescription.
Yes.
And then they also have what they can dispense over the counter.
Okay.
If it's something with your menses, they can't, pharmacies are not allowed to do that. So you will definitely refer you to a doctor. Okay. So you will come there with a prescription to have it served.
Because this is a common problem. Once I went to the pharmacy and a certain lady came to the shop. You know, sometimes you just can't help hearing. It's not like I was eavesdropping, but the lady was quite a bit loud. She was like, oh, my menses in bar 4 months. So it doesn't mean it's a bad thing she did.
So the pharmacy should have directed her to the hospital. She is seeking health care. And health care can be sought anywhere. I mean, in her community. She can even have decided to go to a CHIP compound or a health. So you, the health professional, should be able to direct appropriately where she should go. But having said that, there are situations that even anemia, that means your blood level coming low, can the body now wants to reserve the little that you have, so your menses will stop, so that you don't bleed. In that case, if you walk to a pharmacist, the pharmacist sees that, oh, you are very pale, he can give an hematinic to you. Yes, that's over the counter. That one, you don't need a prescription for it. So he can give that to you and tell you that if it doesn't work, go to the hospital. Because you realize even with a lot of medications, they say if you take it for 2-3 days and you're not getting better, visit your doctor. Yes. So at the end of the day, it will end up on our seats.
And I saw this joke when you said, I mean, you go to so many places before you see that. I saw this joke just this week and I found it very interesting. It was saying that if you have a legal problem, you see a lawyer. You want to build a house, you see an architect. Fix your car, mechanic. But if you have a health problem, first place, internet. Yes. Then your neighbors and relatives. Then miraculous drinks and things. Then TVs and newspapers. Yes. Self-prescribed drugs. And the last place is the doctor. So please,
when it gets worse,
let us repent.
You know, sometimes I'm not supporting people not coming to you. But sometimes, you know, the stress with coming to the hospital, the queuing, the time involved. If you are working, you have to seek for permission. So it's quite like a quick fix in getting better, which from the discussion is not also advisable. So I think we can move on to family planning. There are so many methods with family planning, but I know we know about IUD, the Jadel, so even calendar and all that. But there are so many myths bordering that. So our main concerns as women, you know, we don't like putting on. They say there are some that make you put on and all that. Is it true? What are the safe ones? And would you like to give us a brief enlightenment about family planning?
Okay, so when we talk about family planning, you see, the important thing is to actually get to the family planning place or clinic and have a chat with them. And then they'll introduce you. There are several methods. So many of them. There are barrier methods, there are hormones, there are the implants available. All of them are available. Now, I don't know if your picture on. So,
yes, we have a family planning.
Basically, the ones that cause weight gain, which is a concern, are the hormonal ones. The hormonal ones tend to cause weight gain. They may come in the form of tablets. They may come in the form of injectables.
Yes. So
or
they
are
hormonal.
In the form of insets or implants.
They
can cause... Yes. I know there are hormones. Now they prevent pregnancy. No. Hormones need suppressive ovulation so that you will not get pregnant. So those are the ones that can cause weight gain. But then again, these studies have been done, there are probabilities. Somebody too is using these hormones and will not put on weight. That is why it is important for you to get to the family planning clinic, they'll take you through all the methods, from the condom use to the tablets, the various rings, the vaginal condoms. They have the, IUD, Jadel, the injector. They have all that. And then they'll give you all the side effects. So then you look at it, and then you take your decision. No one will force you to take the decision. But in all these, they have percentages. And I know that the IUD has like the highest percentage.
Of users?
Not percentage of users, of protection. About 99, they are about percent of protection.
But we have the no weapon baby, so.
But I was going to add that even with that one, still those who have decided they are coming.
They come holding the IUDs.
So please, the best thing is to, and then when you start using it, that's why they go have reviews for you. So that you go with your problem. Oh, I started using this one. I'm not comfortable. I'm putting on weight. I'm bleeding too much. The IUD, even though it's safe, for some people too, their menses increase to the point where, they get anemic.
Anemic, wow.
Yes, from using that.
And
somebody
some even report having white candida.
there are also a lot of
infections.
vaginal discharge. Because remember that there's a string at the IUD that comes out. And that string, usually when you're menstruating, you feel it out. And you can imagine anything that comes out can pick up an infection and carry it in. So each of them has their own peculiar side effects and then problems. But it's not going to happen to everybody. So you get there, you have a chat with them, and then you make an informed decision. And then
so that ake, they say.
No,
we shouldn't
don't.
go by it.
No,
and
please.
you can you go by what your mother or an auntie in your family used because you are in the same family? Would you say that you have almost the same genetic makeup? So if maybe it didn't work for your mother, it might not work for you.
No, like she said, family planning is individualized. So what will even work for your twin may not work for you.
Oh, okay.
Okay. And circumstances differ. In fact, you may feel this way today, but by next month, your ideas will be different. For instance, you don't want any hormonals, so you are using barrier methods. That was your best pick. So you start using the condoms. A month later, you realize now you have a lot of discharge, a lot of pain. You find out you have latex allergy. You can't continue using it. But your twin sister may not have latex allergy and can continue using it. Yeah. So it is individualized. And even with you as a person, it still changes over time based on your circumstances. Wow. Okay. Wow. Yeah. You can have, let's say when you start planning your family, you are using injectables. You've had your first child, your second child, your third child, your fourth child. You are convinced you won't have a child again. You will say now you want a permanent method.
Yes.
You see? So even with you, it will change over time. So that's why it's important that you go and talk to a healthcare provider so that per the counseling session you have together, you can choose the ideal one for you at that particular time based on your circumstances.
I'd like to ask a mind-blowing question a bit. Someone just sent me a question. That why is it that the family planning issue is always being hammered on women and not on men? As doctors, do you see any men or men coming to the consulting room to do family planning?
I actually...
Honest answer. They are very few. They are very few.
I haven't seen, but I've seen one. I know one person who has actually had the male
vasectomy.
He has had it done.
Okay.
He decided he didn't want his wife to go through any of those complications.
Oh, so the wife was free.
And they finished, and
now,
then he had it done. I know someone who has had it done. Yes.
Yeah.
But it's not common.
But it's not common.
Yes. Sometimes you have to look at the culture and the society we live in.
It's true.
That has a lot of influence on who does what. Like if you go to the Western world, it's very easy for a man to walk in and say, I want a vasectomy done. I'm sure they will have higher numbers than we do here.
Yes.
Because they will have a lot of superstitions with the vasectomy leading to impotence and all that. And no matter how much information you give them, they will still have that fear. So you will say that because the man is not doing, you too, you will sit down.
You send him back one ebo when you
because all the social community things all play a role in there.
I want us to touch a bit on menopause. You talked about it briefly. Please, what is the expected age? I hear now it can come very early. Yeah. And it's also determined by when you start your menses. They are saying that when you start your menses early, it's highly likely that your menopause will also come early. Is it true? And if it's true, why is that?
Okay, so that's true. But one thing I should have told you when I went in is that every woman, before God creates you, your oocytes are predetermined. So you are born with it. You go to your teenage years, then you start shedding some. So like I said, every month you have like 15 developing. It will come down, some will go wasted, one will be released. So let's say, I won't give you a number because we are all different. Let's say your number is 2 million or 20,000 million. You should know with every month you are losing. With every month you are losing the oocytes. Every month you are losing. So if you have an early menarche, that's your first menses is at an earlier age, it goes to say that your oocytes will finish early. Okay, as you are aging to get to menopause. That's the normal understanding. But you should also know that there are other factors to it, which is the hormonal part.
Yes.
So there are people who will have a problem, and because of that, you have to do surgery and take the ovary out.
Yeah.
You have automatically made the person menopausal.
Yeah.
So those factors are also there. Or people will get a disease, they will go and do radiotherapy. The radiotherapy machine will affect the ovaries. So automatically you get to menopause. So it's multifactorial, but of course you are born with a specific amount of oocytes. The earlier you start shedding them, the earlier you finish them.
Wow.
All right.
And please, we are almost getting to the end of the interaction. We are even ending. I want you to give your questions to the MCs for them to bring to us to ask. And very soon we'll allow you to, if you want to stand and ask the question, we will also allow you. And our online viewers, please begin to post your questions if you have any. I think almost the last question. So I hear people complain a lot about painful sex. Is there any reason for that?
Okay, so yes, painful sex, there may be different reasons.
Okay.
Ranging from just plain infections to cancer.
Okay.
Yes, so pain after sex can be a cause or can be one of the symptoms of cervical cancer.
Oh, okay.
So you must check. Now, if you are in the perimenopausal, postmenopausal, or menopausal age too, you know the lubrication there
is minimal.
It's lighter or it's minimal, so they can also have pain.
Okay.
Certain infections too can cause pain over there. So
Okay.
those are. So the moment you have, it's not a normal. It shouldn't be something you
Condition.
should take as normal. No, you shouldn't have pain. It's supposed to be something that is enjoyable, not to be painful. So if there's pain, then we
There's
must.
a problem.
Yes. Also, you know, psychological and then lack of preparation too of the female.
Yes.
Proper preparation.
Yes.
Foreplay and all those.
If there's not
also,
enough lubrication.
not enough
before-
lubrication too can cause.
Okay.
pain.
Because people, one of the common questions I had was that, so when you are having painful sex, does it mean you have a problem with your female reproductive system? And if so, what can you do to bring it down?
Yeah, so there may be a problem. So you have to go and check it out and see. If you go and there's no problem, then there are some other issues that some people just have certain things like that I mean really we need to just manage with lubricants and things. Yeah.
Okay.
I don't
All
know
right.
if Dr. Damoah has.
Dr. Baaba, do you want to add anything else?
Oh, so yes, as she said, even something as common as pelvic infection can make you have
Pelvic inflammatory disease.
PID, what we call PID, can make you have this parenia, that's painful sex. So, and it's easily treatable. So don't feel bad about it or feel like you have to harbor it, because it may be nothing, it may be something very easy to treat so that you receive your treatment than to keep suffering in silence.
Inside, you know. Sometimes they say one ton yaria, unya anwedru. So it's good to let someone trusted get to know what you are suffering from in order to get medication for it. At this point, audience here and our online viewers, we are open to your questions. Please keep them coming, post them if possible. But I want to give opportunity to those who want to talk in the microphone to ask their questions. So it can be coordinated by our well-able MCs. Thank you.
Okay, so we have one question here already. So we'll take it and then we'll take one person from here as well. Says, please, I have done the fibroid operation and my tubes have been removed. Is there any food or medicine for me to take, for me to be active? Please, I have 2 children. I will not give birth again. I will not give birth again. So removing my tube is not a problem for me.
Doc, please, is it clear enough?
Should I take it again?
Yes, please.
Please, I have done the fibroid operation and my tubes have been removed. Is there any food or medicine for me to take for me to be active? Please, I have 2 children. I will not be giving birth again, so removing my tubes is not a problem for me.
Okay, so if I get it correctly, you've had a fibroid surgery and your tubes have been removed. Okay, so there are 2 types of fibroid surgeries that they do. One is myomectomy. What they do is that they take the fibroid nodules itself out of your uterus and leave your uterus there intact. The second one is to take your whole uterus out along with the tubes and then leave your ovaries down, because your ovaries have to give some hormones to maintain you. I'm not sure which one she's trying to say, but if her tube is removed, most likely her womb is also removed as well, because the fibroid will affect the womb, and that's what they want to treat. So if your womb has been removed with your tubes, the occurrence of uterine fibroid is 0. It's nil, because there's no uterus there to even go for you to get the fibroid again. So it's nil, and of course you understand you will not be able to bear your own children again. So just eating a normal balanced diet. What I usually tell my patients is that every food, use your plate. So half of your plate should have vegetables. The quarter of it should have complex carbohydrates, the other quarter lean protein. And vegetables does not mean salad and fruit all the time. Your soups, your stews, they are all vegetables. Yeah. So if you are eating fufu and your soup, you should know that your soup has to be occupy like half of your plate.
But the fufu shouldn't over the
soup. So just eating a normal balanced diet, maintaining a healthy lifestyle, exercise, is enough to keep you going. That's all that I could say. If I understand the question clearly,
I hope it's clear.
Thank you very much for your answer.
Auntie Linda,
There's one question.
Okay.
Thank you very much for the opportunity. Please, I would like to find out if you have a teenage girl and they go through severe pains every month. Those that are used for calendar. Why a calendar will feel everybody knows you. Does it cause for any alarm? Do you have to prepare for some of the problems that we just listened, like the fibroid or the endo something?
No, not really. You know, there's something we call primary dysmenorrhea. So it means that that is how their menses. We have some of the teenagers coming up like that. Right from the onset, their menarche, the first menses, they have pain. And they will have the pain at that time of the month always. So they must know the date. And sometimes we advise even trying to take the painkiller or an Icgc just before the day that it starts, so that it doesn't come, but it doesn't necessarily mean that that person is going to develop endometriosis or uterine fibroids. No, it doesn't mean that. Sometimes even after delivery, those people, the pain goes away.
Is that always true
that
it happens?
It gets better when you give birth?
Yes.
How does it happen?
Primary dysmenorrhea. It should get better with age, because the reason they are having the pain is because of hormonal balances, which gets better with age. Okay. But what happens is that the primary dysmenorrhea may get better, but when they start now developing or having children, they now develop secondary dysmenorrhea. And secondary dysmenorrhea just means that you have menstrual pain that's as a result of a disease. Some of the examples may be the fibroids, the endometriosis, or even
So she wants a third.
Is it going to affect having your third child and all that? So the doctor is the one who will be able to tell, because we don't have prior information to how big the fibroid is, or whether it's affecting you, you are bleeding, or whether you're having pain, or whether it's going to affect your fertility. But with that kind of age going up, fertility usually, like we said, is declining or it's reducing. So they may need to have some assistance of some sort.
Okay.
Another
Please,
question.
Let's keep it coming.
I have a little fibroid in 36 years of age. I'm 36 years of age.
and I'm 44 years now.
Menopause. I don't know whether you are still bleeding. So right after menopause, the nodules will actually reduce. So by the time you are 60, it's not likely that it will have grown bigger for you. No.
Thank you very much. The second question. Is it possible or normal to bleed twice a month?
Is it possible to bleed twice a
Twice
month?
a month.
Yes. So if you remember, I said that normal menses is 28 days plus or minus 7 days. So that means that any days from 21 all the way to day 35. So imagine, but it has to be your regular cycle length. So let's say your regular cycle length is 22 days or even 23 days. And you have your menses on the 1st of September. That means by 24th September is your next menses. So you would have bled twice in the month, which is normal for you. But let's say somebody has a 30-day cycle, and then has the menses on the 1st September, and on the 20th he's bleeding again. That is abnormal for the person. So there's no right or wrong answer to that question. You have to know your cycle length and know whether your cycle length is becoming shorter than the 21 days. So that in that case, it will make you bleed 2 times in a month or not.
Thank you.
I hope it helps.
Another question. Is it possible to get pregnant when one does tubal sterilization? I am asking this because on Sunny FM, someone got pregnant, even with that. Can this be explained? Please.
No weapon babies.
You know, it's if it's been tied, it naturally shouldn't be possible for you to have. But we've also seen a couple where it has happened.
Those are the miracle babies.
Somehow the tube has grown back.
Wow.
And
So
then
the
it
tube
has-
can grow back.
You know,
So
once
you call it recanalization.
Yes.
Form another connection.
It forms another connection.
Yes, and reaches out to the uterus, and then they communicate again.
Wow. When you scan, really? So that means even the permanent one is still 99.9%. So there will be some 0.1%
That is,
chance
you know,
of
that
getting
gap
pregnant.
belongs to
Wow.
the Lord.
And then I said, Anna. Wow. Oh, please proceed.
Yeah, so that's
Okay, so there's one more question. What are the causes of no sensations during sex, and what are the solutions?
Sexual intercourse is a very diverse mechanism. It starts from your brain. Then other things involved like your body, your hormones, now your pelvic, your reproductive structures we have talked about. So as to what causes you not to have any feelings at all in sex, it has to, I can't sit here and tell you, it can be so many things. So I believe if you have that problem, the best solution is to speak to your healthcare provider. Based on the history we take with you, asking questions, this, that, it can point to a particular part of the problem. Then we will deal with it for you. I think that's better than...
Doctor, please, if a woman wants triplets or quadruplets, what are the things she should do to get this children?
It's a good place to clap. People want twins and quadruplets.
If you are clapping, clap well.
The excitement says it all. People want twins. Oh, dog, is there any way?
What are the things she has to do to get these children? And what are the foods to eat?
Hey, food, baby.
Please, thank you.